Good morning, everyone. Welcome to day two of the second annual summit on global innovations in patient-centered kidney care. Thank you, everyone who attended day one. Leadership at AAKP, again, thanks our staff, led by our Executive Director, Diana Kleins, assisted by Erin Kale, who's Director of Stakeholder Operations. A quick recap. Yesterday, we heard from Dr. Rogers of NIDDK. Under his leadership, patient engagement at NIDDK is soaring to new heights and really setting a standard for government agencies and industry in terms of patient engagement. We also heard from old friends, Melissa West, for example, who's leading the Kidney Health Initiative for the American Society of Nephrology, as well as Jonathan Hebefarm, who's director of the Kidney Research Institute, who leads the KPMP, the Kidney Precision Medicine Project, which focuses on identification and diagnosis of kidney disease. My good friend, Dr. Kathy Tuttle, who happens to be my co-chair on the Community Engagement Committee for the Kidney Precision Medicine Project. She also serves as the Executive Director for Research at Providence Healthcare. And we met a number of new friends, including Dr. Olivia Cates, University of Washington. She spoke on treating immunosuppressed populations during a global pandemic. We also heard from Shahid Mohammed, and he provided us with a very insightful discussion on international perspective on patient engagement. I had the pleasure of introducing Dr. Cheryl Ann Winkler from the National Cancer Institute, and she spoke on the topic of APOL1. And then there was Dr. Claudia Ronco, hailing from Italy, of the International Renal Research Institute, and he discussed AKI, or acute kidney injury. AAKP again is here today with our co-host, the GW School of Medicine and Health Sciences, to continue on with our agenda about kidney patients and innovations. We have a full agenda today. Let me frame today's session for you. We continue our emphasis on COVID-19, but we also go beyond COVID-19 as we look at areas such as nanomedicine, telehealth, and telemedicine, emerging research in areas of early diagnosis and artificial intelligence, novel therapies and transplantation, including wearable and artificial implantable devices. We look at the kidney community stakeholder response to COVID-19, and we also look at the need for international cooperation. And we get an update on the VA's response to COVID-19, and we also take a look at advancements in home dialysis care, which is certainly a growing trend and creates another significant choice for patients. Again, I want to thank our sponsors. We have Amgen and CareDx as our silver sponsors, Natera, Eurofins, and Outset as patron sponsors, and Retrofin provided a supporting sponsorship. We appreciate their support of our second annual Global Summit. In closing, I want to take a few moments to share a message from my Juneteenth message that I send out. As a kidney community, we should take heart knowing that united together in purpose, we have shared intelligence and capacities to drive many more innovations and save many more lives. To do this, we need more thoughtful patient engagement, which means the inclusion of even more minorities in research, clinical trials, disease prevention, and treatment education. Most importantly, we must be united in our resolve to end disparate treatment and care, and to expand care choices for all kidney patients, because every kidney patient has the right to pursue dreams and life goals. Now, I will turn it over to the moderator.